Welcome to the Zambia Institute of Sport, TVETA, and National Sports Council of Zambia accredited Sport First Aid course. In Lesson 1, we look at how to manage sport-related accidents. Accidents can happen at any time, sometimes with injuries that, though unfortunate, are often preventable from having long-term crippling or even tragic results, provided trained first aid practitioners are able to intervene as soon as possible after the accident occurs. An important part of any administration of first aid is the safety of all the people involved. The first active role of the first aider is to ensure their own safety and then the safety of the persons who require first aid. Learning outcomes are to develop a good understanding of assessing the scene of the accident, identifying casualties, dealing with casualties, when to call for help, creating an emergency action plan, stress management. The laws of the game state that the referee or umpire will decide, once the ball is no longer in play, whether a player requires first aid assistance from the first aider. Do not enter the field until the referee or umpire has signaled for you to come onto the field. If the field is not safe to enter, for whatever reason, do not enter the field until it has been declared safe by the referee, umpire, or local security personnel. Shout for help if you are called to help a player on the field. Make sure you have others to help you. If you come across the player unresponsive and you are alone, call immediately for help. Assess if the player is responsive by asking them loudly, "Are you all right?" Speak to the player in a clear, loud voice. If they do not respond, apply painful stimuli by squeezing their earlobe between your thumb and finger. And if they still do not respond, assess the airway to see if it is clear. Always consider a neck injury and do not shake an unresponsive player in order to assess their response. Assess the player using the ABCDE approach. Check to see if further medical assessment is required. This may be in the form of an ambulance being summoned, for example, for a suspected neck injury or a profusely bleeding wound that cannot be managed with basic first aid. When responding to an emergency, it is important to recognize the emotional and physical needs of everyone involved, including your own. Make sure you look after your own health and be aware if you start to feel stressed. A calm, considerate response is necessary so you can reassure the casualty and find out the information you need from them. Be calm in your approach. Be aware of risks to yourself and others. Build and maintain trust from both the casualty and bystanders. Treat the most serious, life-threatening conditions first. If worried, call for emergency help straight away. You cannot treat what you cannot see. You must be able to see the injury in order to be able to effectively treat it. Injuries may be hidden under the player's clothing. Expose the relevant injury by removing as much clothing as is necessary to look for underlying injuries. Consider the player's medical history that you are aware of so that you can assess and pass this information on to the ambulance on arrival. Broken bones usually aren't life-threatening, but they do require immediate medical care. Learn how to recognize the symptoms of a broken bone, provide first aid treatment, and get professional help. When athletes suffer from major injuries, they show signs almost immediately. In most severe cases, they won't be able to put pressure on the joint and won't be able to keep playing. In some cases, the athlete will need surgery followed by physical therapy in order to recover. An athlete with a minor sports injury, like a sprain or strain, will likely notice the pain but might associate the pain with no more soreness. Likewise, the coach might not notice the slight limp or slightly swollen ankle. That's why it is important for athletes, parents, and coaches to understand and pay attention to the signs and symptoms of minor sports injuries as well, including pain, swelling, bruising, muscle weakness, and a limited ability to move the affected joint. Accidents and emergencies will happen from time to time. During the chaos and panic that accompanies such incidents, the application of emergency first aid can mean the difference between life and death, saving lives and bringing order in a serious time. This course helps prepare you for such a time. For further information, refer to pages 16 to 50 in the First Aid Manual. Visit the following link for a visual representation of what we have discussed.